To the resolution.
To the resolution.
Representatives, colleagues, fellow Oregonians, hear my words. There are three reasons why we should oppose House Joint Resolution 18. Constitutional, cost, and character. Amending the Oregon State Constitution is serious business, and we should carefully consider the ramifications, the implications of doing this and ask ourselves if it would be wise to consider the unworkable precedent of stating that certain important, essential safeguards to human rights or to human life are fundamental. What are the basis? When we talk about fundamental rights, shouldn't we first consider fundamental principles? When the Constitution is involved, we should consider the fundamental principles first. It's not just about doing good. It's about changing the Constitution. What are the fundamental principles? I mean, Thomas Jefferson, in my opinion, stated the overriding principle for our country in 1776 when he said, "We hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness, that to safeguard these rights, governments are instituted among men, deriving their just powers from the people." And so, as we consider amending the Oregon Constitution, are we exercising the just power to say that we will have a fundamental right to health care? And yet, that's what we're doing. And it's easy to say, well, the bill doesn't really say that we're going to fund universal health care. But what we may not understand is that there's a difference in how you interpret different parts of the Constitution. For instance, one court said, traditionally, courts have applied a rational basis test for equal protection analysis when a fundamental right is not implicated. Rational basis is easily satisfied. The more stringent test, strict scrutiny requiring the state to show a compelling state interest, is seldom satisfied. Well, we are creating a fundamental right, which is not going to be something that's dealt with by a rational basis comparison to education or other rights that are mentioned in the thick Oregon Constitution that we have. We are saying it's a fundamental right. And so what's going to happen is, whether or not we fund universal health care in Oregon will be determined by a strict scrutiny basis. And in all likelihood, the court's going to say, this is determined in the wording of the amendment to the Constitution that this is a fundamental right, and therefore it is a mandate on the legislature to assure that this right is fulfilled. And so we'll find ourselves saying, what have we done now? What are the consequences of what we've done? We sent it to the people, and they voted for it. And now we are stuck with the responsibility to implement it for 3.76, almost 7. A lot of babies being born. Thank you, Brother Cannon. 3.6 plus million people in the state of Oregon at $4,500 each, roughly. But don't worry, it does go up. It doesn't go down. So we start with $16.2 billion in the first year that everybody's covered. That's $32.4 billion. That's billion dollars. Now that's a lot of money when you're talking about $32.4 billion in a biennium at 7 to 8% inflation. Where's that money going to come from? It has been discussed. The discussion focuses on things like, well, we just need a payroll tax. After all, businesses are already paying for health care, and so if we just implement a payroll tax, then instead of just having certain of our companies having to pay for health care. We'll share the cost over all the companies. What could be more fair with that? Well, we did call and ask, what is a payroll tax generating?
Representative Gilliam
And so
yields.
We're told, well, 1% of a payroll tax will generate about $650 million. Oh, let's see. We want $16 billion, and we can get $650 million for 1%. That's roughly 26%. So, those of you who have businesses, we've got good news and bad news. The good news is you're going to have health care, and you won't have to pay for it for your own employees anymore because all the businesses are going to share in it. And the bad news is it's going to cost you 26%. That's more than PERS. 26% of every payroll dollar will go toward health care at the current cost. No incentives to lower cost. No incentives or changes as far as what we're going to do to have more effective delivery because the government's going to do it. So we have a problem constitutionally. We have a problem from cost. And I would also propose that we have a problem with character in this issue because what we're doing is essentially saying to people, it's expensive to have health care. You want health care. Don't worry about having to deal with this on your own. We, the government, will provide it for you. Of course, that's the basis of the proposed consideration of the amendment, right? Because if the government's going to provide you health care, then you don't have to worry about that. We'll take care of you. Well, from cradle to grave, if we're going to take care of them, let's do food, clothing, shelter, and health care. Does that sound like a different kind of government than we recognize as intended from the basic foundation of our nation? And so what we need to be doing is getting our arms around the health care crisis. We need to take action, and it's got to be a coalition. We need to take action that involves the government, individuals, industry, and business. But historically, what happens when the government says, well, we're going to take care of this, so you don't need to worry about this, but although we'd like you to participate, everybody goes home because the government's going to handle it. We don't need a constitutional amendment guaranteeing a fundamental right to health care at a cost that we can't afford. What we need to do is focus on getting something done in this body to build the coalitions, to meet the need, to make the changes, to provide the incentives, to turn a circumstance or a system where the money that's generated to healthcare providers is based on how many visits and how many procedures, and move that into where the compensation is based on the health of the people. Is this going to do that? No. It does say we'll set up a system, but it doesn't say what the system's going to be. But because it's a fundamental right, the system will be implemented, and the cost will be dear. And when we find out that payroll taxes won't do it because of the appreciating costs, we will find that we will be forced to look at other areas of our budget, such as K-12, community colleges, universities, public safety, because that's where the money is, and when you've got a fundamental right that must be funded first and foremost, that money's going to come from somewhere, and it's not going to just be from tax increases. I implore you to consider the long-term consequences of what sounds like a good idea. I mean, after all, we want everybody to have health care, and we do. We want everyone to have access to health care, absolutely. But it should not be a constitutional mandate, because the consequences, instead of helping to accomplish that and benefiting our society, will put us in the unthinkable position of having to fund universal access to health care at the expense of employment, future employers who would consider coming to Oregon, at the expense of our economy, at the expense of educating our children, at the expense of making sure that our people are safe through proper funding for public safety. The need for universal access to health care will require time, effort, and cooperation of government, industry, and individuals, private business. Such a coalition will not be harmed if we will work together, and it will be harmed if we implement this bill. Colleagues, once government is required to solve the problem, the participants will leave, and we will be left with an untenable position. I
President
implore
Crumble
you,
yields.
do not allow this constitutional amendment to go forward. It is not good for Oregon, and it will do more harm than good. Let us deal with health care, but not through the health care fundamental right in a Constitution.